Welcome back. So now we are going to discuss what causes cataract. So cataract, there are multiple causes can lead to this. We discussed one of them. We said aging. It can be part of the normal aging process. Another part is genetic. And really genetic is not that we identified necessarily a gene that leads to the cataract, but it just seems to be that people who develop early cataract seems to be that the generations coming from them will also develop early cataract and vice versa. So those that develop cataract at a late age or a late stage, they also have the same. So it's the progression rather than the exact development of the cataract. A common cause, and this is where we can see sometimes it happen even in younger age and even in children, is trauma or injury. Blunt trauma can lead to that, like tennis ball, like squash ball, all this can lead to cataract, but sharp objects penetrating the eye and touching the lens can lead also to cataract formation, and it's called traumatic cataracts, and also is, luckily enough, it is manageable. Diabetes, the uncontrolled diabetes can lead to the development of cataract at an early age. So if diabetes is not controlled, especially type 1 diabetes, you can see patients who are in the late 30s or even early 40s that they could develop cataract. Also, some medications are known to have cataract formation. The most common one for us in the eye is steroids. But I just would like to mention that chronic use of steroids is the one can lead to cataract. So sometimes we need to prescribe steroids for a week or 10 days. This usually doesn't affect as much as those patients who are on chronic medication, especially corticosteroids. And obviously, also, there are some environmental factors that can lead to progression and fast development of cataract, smoking, ultraviolet light, so the exposure to sunlight a lot, and obviously also nutrition plays an important role, especially if the unhealthy part of the nutrition is part of the regular dietary intake. The next one is Are cataract types? Yes, there are a lot of types of cataract. So first, it can be a congenital type. This means that the baby could be born and can be diagnosed at birth or few months after birth with the development of cataract, and we call this type is congenital cataract. The second part, or the second type, what we see most commonly, especially with the aging cataract, this is the lens. I took it out and I just put it on a horizontal plane. And there are several types of cataract that we know very much. One of them develop in the center of the lens, which is called nuclear cataract, coming from the nucleus of the lens. And there are others that actually start at the periphery, could be in either side of the lens or at the periphery of the lens, and they usually start to creep towards the center. We call it cortical cataract. And then there is one developed on the posterior shell or the posterior part of the lens. We call it at the posterior subcapsular. This is called the anterior capsule of the lens. This is called the posterior capsule. So it develops at the posterior capsule. Why we are mentioning this? Because they have some implications on how the patient complain. Those coming in the center, like the nuclear or the posterior capsular, they affect vision dramatically. If you remember, light needs to come. If it is in the center, it will affect vision. Those on the periphery here, as they start to develop, patient will start to complain of glare, especially at dark. Why at dark? Because the pupil dilates, so these cortex started to be a little bit exposed. So patients started to see in the periphery some glare. He started to see that the light is distorted a little bit, but does not affect actually the vision as much. But later on, once they progress toward the center, they can affect the vision. How we diagnose cataract? Cataract can be diagnosed by just simple examination. So obviously, first thing, visual acuity. We just see that the patient has decreased vision and cannot be corrected by the usual correction of a contact lens or a glasses or something like that. The second, we also examine, we have usually if you go to your ophthalmologist, you will find like a microscope, we call it a slit-lamp. This microscope can provide magnification and we can see clearly the cataract on the lens. Very important that whenever we examine for cataract, we have to examine while the pupil is dilated. So you have to get eye drops, dilate the pupil in order that we can see the periphery of the lens very well in order to exclude that there's a cataract or there is cataract or there is no cataract. In my next episode, I'm going to speak about management of cataract, in particularly about the surgery, the type of the surgery, and the type of IOLs we can use with the surgery.